Hi, my name is Dr. Zuckerman, and today we're going to talk about peripheral neuropathy and how we can help you. I have postgraduate education with the Chiropractic Neurology Diplomate Program with the Carrick Institute. I'm a licensed chiropractic physician in the state of Florida since 2004. I've studied functional neurology, functional blood chemistry, functional endocrinology, and functional neurotransmitters. 3 things that you need to know about my office. Goal number 1 is to reinvent your life. My second goal is to have a maximum positive impact on every single human being that I come into contact with. And my third goal is to offer you an exit strategy, which means that if I show you what to do and you make the appropriate lifestyle changes, we can help improve your condition. Are you sick and tired of going from doctor to doctor and not getting the results that you're looking for? How long have you had your peripheral neuropathy problem for? 2 years? 20 years? Keep in mind, the problem happening that is causing your peripheral neuropathy probably has been happening even longer than your diagnosis date. That's just when you were diagnosed with your symptoms and the doctors gave you the label of peripheral neuropathy. What are you doing to improve your peripheral neuropathy? Are you seeing the results that you want? If you're suffering with peripheral neuropathy, you have what we call a chronic health condition. You are suffering from what I call a web of physiological dysfunction. None of you, 0 of you, have just one problem. That's a physiological impossibility. It's physiologically impossible to have just one thing going on to lead to your peripheral neuropathy. What do I mean by a web of physiological dysfunction? This is a web of physiological dysfunction. That means you may have a problem with your nerve and brain, thyroid problems, gut problems, short-term memory problems, metabolic problems. Remember what I said, you could be suffering from brain-based symptoms. What you can do is you could turn to the sheet of paper that was sent to you in the packet that we sent to you with this DVD that has the yeses and nos on it. Circle the yeses and nos that pertain to you. If you have 5 or more yeses, this is a brain-based questionnaire. There could be a brain-based problem. Now, what do I mean by a brain-based problem? When it comes to the frontal lobe of your brain, have you noticed that you've had personality changes occurring? Depression, anxiety, irritability, any other changes? When it comes to the hippocampus part of your brain, this is where you store short-term memory. Do you have any memory problems? Do you forget where you put the keys? Do you forget people's names? The parietal lobe is the part of the brain where all sensory input fires into your brain. If this starts to short circuit, you will have pain, numbness, tingling throughout your body. You have your brain, it controls every single function in your body. It sends electrical signals down your spinal cord to your feet, but also to every organ and every part of your anatomy. Nerves go to organs, nerves go to extremities, nerves go to your spine. When it comes to see how the rest of your body is functioning, turn to your metabolic assessment form. Remember, I mentioned to you that it's physiologically impossible that you just have one thing going on to cause your peripheral neuropathy. We're going to prove that to you today. So what you're going to do is you're going to go to this sheet of paper, and there's 2 sheets, this one and this one. You're going to mark off any 1s, 2s, 0, 1, 2s, or 3s for each category. If you have any 1s, 2s, or 3s in any category, you potentially have a problem and it needs to be further evaluated when it comes to that organ system. For example, what I would like for you to do is take out a white piece of paper and I want you to draw PN, the letters PN, and put a big circle around it right in the center of the page. If you had 5 or more yeses on the page that I mentioned to you before, the neurological assessment form, I want you to draw a line up and put the word brain in a circle above peripheral neuropathy. We're going to construct your web and show you what is leading to your peripheral neuropathy. And we're going to do that with each category that we're going to go through with you from your metabolic assessment form. Category 1, if you have any 1s, 2s, or 3s, once again on this metabolic assessment form, any 1s, 2s, or 3s, that deals with your colon specifically. How many doctors have you been to for your peripheral neuropathy that wanted to evaluate your colon to see if there's a problem? Category 2 and Category 3, those categories deal specifically with your stomach. So if you have any 1s, 2s, or 3s in Category 2 or Category 3, make a line coming from the peripheral neuropathy bubble and put stomach in a big circle. Now if you have 1s, 2s, or 3s in Category 2 and Category 3, I want you to put a parentheses 2 within that bubble, meaning you have 2 problems potentially with your stomach. Now stomach acid is very important for proper nerve function. H. pylori infections are often associated with neurological symptoms. Category 4 on the metabolic assessment form, if you have any 1s, 2s, or 3s in category 4, that is your small intestine. So draw a line off of your peripheral neuropathy bubble, put small intestine in a big bubble, and understand that 90% of your food is assimilated in the small intestine. If your small intestine is malfunctioning, there is absolutely no way you could break down food properly and turn it into energy for your body to heal. Category 5, if you have any 1s, 2s, or 3s in category 5, that deals with your liver and your biliary system and your gallbladder. I want you to draw a line coming from your peripheral neuropathy bubble. If you have any 1s, 2s, or 3s, once again, draw a line from your peripheral neuropathy bubble, and I want you to put in liver, gallbladder, biliary system. You could just put L and G for liver and gallbladder. The liver is very important for metabolic function. Thyroid conversion occurs here. B12 methylation occurs here. Hormone clearance occurs here. You're not getting the type of care to get you better because insurance model of care is set up inappropriately. They are focusing on treating symptoms. You're not getting the type of care that you're getting because it's the most effective. You're getting it because your insurance covers it. The sooner you understand that you can take control of your health and the treatments for your health condition shouldn't be determined by your insurance company, it should be determined by what is happening with your body, the better off you'll be and the quicker you'll get better. The only thing that matters, write this down, the only thing that matters in my office and to me are results. And if you're not getting any, that's all that matters. Okay, so if you circle categories 1 through category 5, put all those, I want you to draw a circle all around category 1 through category 5, which was your colon, your small intestine, your stomach, your liver, and your biliary system. And all of them can be classified underneath one name, your gut. Instead of your digestive system, we're going to call it your gut. 70 to 80% of your immune system is found in your gut. The father of modern medicine, Hippocrates, said, "Look to the gut, there you will find the origin of almost all human illness." Anything that causes an immune battle in your gut will trigger inflammation. For example, things like food sensitivities, chronic infection, bacterial, parasites, mold, fungus, yeast, viruses, undergrowth of good bacteria, or normal flora. Let's move along on your metabolic assessment form. We already covered category 1 through category 5, and that deals with your digestive tract, which we're going to call a gut. When you have a chronic inflammatory process stemming from the gut, the brain and nerves can actually, and the rest of the body could actually be chronically inflamed. Category 6 and category 7, moving along, that deals with blood sugar. If you have any 1s, 2s, or 3s in category 6 or category 7, draw a line off of your peripheral neuropathy center bubble, put glucose or sugar, blood sugar, in a big circle, and I want you to understand that the appropriate optimum functioning range of blood sugar should be between 85 and 99. And I know some laboratories will tell you that going as low as 65 is normal. I don't consider that normal. I consider 65 to 84 hypoglycemia, and I consider anything above 100 insulin resistance or pre-diabetic until you get to about the 130 range as well. So although some doctors may tell you that having a blood sugar level of 115 is nothing to be concerned with, that concerns me. If blood sugar gets too low, it will affect nerves. For maximum results, you have to improve your blood sugar. There's not just one thing wrong with you, is there? I'm helping you to understand how all these things can lead to abnormal nerve function, chronic inflammation in your body resulting in your peripheral neuropathy. By the way, blood sugar in the brain, properly regulated blood sugar is a primary source of fuel for your brain. Poor blood sugar regulation leads to poor brain function. That's a fact. Moving right along with your metabolic assessment form. Category 8 deals with your adrenal glands. Actually, category 8 and 9 deal with your adrenal glands. Your adrenal glands are small glands that sit on top of your kidneys. They release cortisol and other hormones in response to stress. What happens when cortisol goes up? Your brain actually gets affected when cortisol is increased. Mostly your hippocampus, which is responsible for short-term memory difficulties. So cortisol leads to chronic inflammatory events in the human body. Cortisol, the hormone cortisol in abnormal quantities, can also lead you to become insulin resistant, which can affect blood sugar levels as well. Cortisol is your best friend in proper quantities, but could be your worst enemy in abnormal quantities. So what is the direct correlation between the adrenal glands, or sections 8 and 9, and your neurological assessment form? The adrenals also release epinephrine and norepinephrine, which you know as adrenaline, which stimulate pain fibers abnormally. There's 7 stages of adrenal fatigue and abnormal adrenal function. We need to do a saliva panel to determine which phase you're in. A phase 2 depletion is a different protocol to help you than a phase 6. Moving along in the metabolic assessment form, category 10 and category 11, that deals with thyroid function. This is very important because your thyroid affects everything. Bad thyroid, bad brain, bad thyroid. Every cell in your body has thyroid receptors, which means every single cell in your body has a keyhole for your thyroid key. Every single cell in your body needs thyroid hormone to function well. Your thyroid gland supports bone metabolism, your immune system, your brain and nerve system, your peripheral nerves, your endocrine system, such as your adrenal glands, your ovaries, your testes, your GI or your digestive function, liver and gallbladder, growth and sex hormones, fat burning, insulin and glucose metabolism, blood sugar, healthy cholesterol levels, proper stomach acid. Every cell in your body has thyroid receptors. Have you been told all of your lab tests are normal? You go to your doctor, you're still suffering, and they're telling you everything's within range. Remember, either they're not running all of the tests, in my opinion, or they're using traditional lab ranges. I go based upon a specific set of lab values called functional ranges, which is a narrower margin of blood values, which means that we get to detect disease processes before they come full force by looking at a narrower, healthier range. Lab ranges to me are inaccurate. They're based on unhealthy people. Functional lab values are more sensitive to reveal problems. Here's an example of functional ranges according to the Functional Endocrinology Society. Here's the point. If you want to see normal, get your lawn chair, bring it to Walmart, and sit down and see all of the unhealthy and overweight people, just unhealthy people out there. The new American normal is not what it used to be. The new American normal is based upon unhealthy individuals that I don't want to get compared to either. So this is your web of physiological dysfunction. You have written down and drawn off of your peripheral neuropathy bubble all of the systems that are being affected in your body. Remember, it is physiologically impossible. You have one thing wrong with you leading to your peripheral neuropathy. And the traditional way of treating peripheral neuropathy in the medical world is either Lyrica, or I should say in the pharmaceutical world, is either Lyrica or Neurontin, which are designed for seizures. Those things, when it comes to our current patients, they either don't improve well, or they actually get worse when they use medications like that. Go on the internet, open up your web browser, and search the abnormal side effects of taking Lyrica and Neurontin, and you'll see that it should be a last resort, not a first resort. I'm here to offer you an alternative to taking those things. Now, if you understand what I'm trying to explain to you, your whole body is affected, leading to your chronic health condition. You have a chronic health condition with peripheral neuropathy, which means multiple things are leading to that condition. You cannot treat a chronic health condition with acute protocols. Acute protocols are defined such as the hospital system. If you have a heart attack, you go there to the hospital and they can help you recover from that heart attack. If you have a serious health condition that needs immediate attention, they can help you drastically and improve your life substantially. However, when it comes to chronic health conditions where multiple systems are involved, we need to look at how the whole body is functioning. So we look at the function of the whole body and see how it's leading to your peripheral neuropathy and why you have chronic nerve and pains and tingling and numbness. So if what we're saying makes sense to you, the first question that should be coming to your mind is, okay, it makes sense that I have a chronic health condition and multiple organ systems leading to my peripheral neuropathy. But where do you start? There's actually an order to all of the chaos that I have already explained to you. Here's the order that we need to look at you if you want to see ideal results. These are what we call health breakers. We need to look at these to determine what is happening, or you will never get better to the level that you want. Do you have an autoimmune disorder? Autoimmune, by definition, means that your body's immune system is attacking your own healthy tissue. If you are autoimmune and you have a problem with your joints, you're diagnosed with lupus or rheumatoid arthritis. If you're autoimmune and you have a digestive dysfunction, you're diagnosed with celiac, colitis, Crohn's. If you're autoimmune and you have a thyroid problem, you're diagnosed with Hashimoto's. A lot of research out there is showing that Alzheimer's and dementia may be an autoimmune problem. Do you have an autoimmune disorder? If you were never tested, you will never know. We need to look and see. We need to evaluate blood sugar. Blood sugar is the #1 stressor in the human body. It can cause problems anywhere. So the second thing that we need to look at is blood sugar. And so this is the order of how we need to look at you. Are you anemic? Iron deficiency anemia, B6, B12, pernicious anemia. Do you have abnormal blood values? We need to look to see, do you have an inflammatory problem? When somebody's inflamed on the inside, remember, we could do tests such as CRP, C-reactive protein, or homocysteine. If you have chronic inflammation on the inside, it's like someone coming into your house using a blowtorch and burning up your refrigerator, burning up your pancreas, burning up your intestines. Chronic inflammation is horrible and could lead to detrimental health results. For those of you who have actually had a colonoscopy and you saw the pictures and images from your colonoscopy, you know exactly what I'm talking about. Inflammation isn't just minor gingivitis. Inflammation looks like chronically red, inflamed, blown up tissue. What is your gut function? Remember, 80% of your immune system is in your gut. If you have an immune system problem, you'll have a whole body problem. We also need to look at thyroid hormone function and also fatty acid metabolism, which means how well you digest fats. Life is a matter of choices. My goal was to reinvent your life, and I feel I've done that. Knowledge plus action equals results. I just educated you about what you need to do to get better. Without you taking action, you will not get better. You need to ask yourself, how will my health improve if you schedule a visit in my office for a thorough evaluation? Ask yourself what would happen if you decide not to come into my office for an evaluation. Think about where you see yourself in 3 to 5 years if you don't address what we've spoken about in this workshop. So the first step is set up an evaluation with our office. We'll do a case review including any previous labs that you've already had done. A complete head-to-toe neurological examination including a qualitative sensory examination, cerebellar and brain screening tests, orthopedic and spinal examination, and a metabolic evaluation. For people coming into our office, this evaluation is typically a $200 evaluation, but by requesting our information and watching this DVD, we are going to save you $140. It becomes a $60 evaluation and includes the first visit, which I just stated, the comprehensive evaluation, and also includes the follow-up visit where we can explain what your problems are and if we can help you and what we need to do. Insurances only cover a very small portion of what we do here, but my goal is to get you better. We need to potentially do an adrenal stress index, which is a saliva panel. We need to do a food sensitivity panel to determine are you eating foods that you're sensitive or allergic to that's causing chronic inflammation and your nerves are affected. We need to do an immune panel if you haven't had it done already to determine are you autoimmune, is your immune system attacking your own healthy tissue. Spouses are encouraged to come to this evaluation because they typically want to know what is happening with you. My goals are to improve your peripheral neuropathy. My goals are for you to walk through a mall and not have to stop every 5 minutes because your legs are getting tired and you're in pain. My goal is for you to safely drive a car where you could feel the gas pedal and feel the brake. My goal is for you to be able to start your car without you having to listen to see if the ignition switch turned over. My goal is for you to get back to golfing and playing tennis and doing the activities that you love without being limited. My goal is for you to go to sleep at night and to stay asleep, not have trouble getting to sleep and waking up because of the burning and cramping in your calves and your feet. I want to add value back to your life. Give us a call today. I look forward to helping you.